Thank you for joining us. I'm Lisa Jackson with JRMC Foundation, and I'm with Patrick Trainer, the Executive Director for Dakota Medical Foundation and the Impact Foundation. I'm thrilled to be here, socially distanced, of course, since we can't do this in our regular Pillars of Giving event, in your makeshift studio, which is wonderful.
It's great to have you here, Lisa.
Thank you. Thank you for being so accommodating. I'm thrilled because the reason why we're here is to thank you and acknowledge you as our 2020 Community Difference Partner of the Year.
Wow. Well, we couldn't be more ecstatic. When you told us about this, we told our entire team and our board. And, we're so proud of the great work that the Jamestown Regional Medical Center does and provides, in terms of improving health. It's right up DMF's mission because Dakota Medical Foundation used to be a hospital. So, we really are grateful for the recognition, but we only accept it on behalf of all the charities across North Dakota, Northwest Minnesota that are doing just fantastic work improving health and access to care, quality of life. And that's really what your foundation and your healthcare organization stands for, the good health of the people of the region. And so we're completely aligned on those things, but we really wouldn't feel right accepting this without giving all the recognition where it's due. And that's all these donors. We were just talking about your donors and how important they are to building a cancer center and how much that volume, has gone up. And I'll tell you, from a Dakota Medical Foundation standpoint, we're just thrilled that you have all these donors and that you have a great relationship with the community and all the people, the families that you serve. You have specialty care in Jamestown. You'd never be able to have a lot of those things if it weren't for your generous donors. And so, we accepted on their behalf, too, this award because it's about giving. It's really about giving. So salute to you, Lisa. It's great to have you here.
Thank you. As you know, margin grows mission. And both of these foundations, DMF and Impact, have been a platform for healthcare in our communities for not only organizations, but individuals who are truly in need and facing some really tough times. And then we haven't even talked about the platform of Giving Hearts Day, which is tremendous. In 12 short years, Pat, you and your teams have raised over $90 million for the charities in North Dakota and Western Minnesota in the first online fundraising platform that was ever out there. And it's been a blessing to be a part of that. For JRMC Foundation alone, it helped catapult $380,000 in support for life-saving and changing care. And we've just been participating since 2015. So
that's incredible.
Ooh, that's very incredible. But how does it make you and your teams feel to support charities and have such an impact?
Well, we see ourselves as part of this team. We're the same team. We're a part of your team. We're a part of the team of all these charities. And, it's great to give the history of Giving Hearts Day because the idea was one of my teammates' ideas, Gina Pinovich. So I think it's incredible how, the landscape of philanthropy has really been changed by one individual that came up with an idea. And of course, we went with that idea and we got people like you involved in lighting up the communities to do good for others. And I really think, people are kind and generous, but they also need to be invited to be a part of this special day. So it doesn't work unless we have charities like yourself, healthcare foundations sort of leading the way. And, now we're up to 500 charities will be in Giving Hearts Day 2021. So, it doesn't happen without the donors as well. So you have 34,750 people gave 2.3 gifts just last year in the 19.2 million. I mean, it's kind of blows your mind how generous, the good people of our region are. And of course, with an online event, alumni, friends from all over the country give to their hometowns like Jamestown. where they grew up, and they're grateful for their upbringing and the warm fellowship that exists in a rural setting. But you're providing health care that an urban setting provides because of the generosity of the region. And so hats off to you.
Well, thank you. There isn't a lot of margin in nonprofit healthcare. And so Giving Hearts Day is a platform that helped us build a cancer center, bring our germ zapping robot, Rosie, to our facility 2 years ago. Who knew? We couldn't predict a pandemic like this, but it has been transformative. When you look at helping others and helping these charities grow, it's more about, it's not as all about the money. You've done some transformation with growing structure and capacity of nonprofits that I think should be acknowledged as well.
Well, and that's where I will give some great credit to the entire team here at Dakota Medical and Impact Foundation, and then all the people that help us to deliver training. There's an unlimited potential to do good for others. And so we like to think that we provide a spark, a pathway to becoming extraordinary at producing impact in these charities. So fundraising, high impact boards, high impact healthy workplace cultures, and now we're pivoting to digital events. So I couldn't be more proud and honored to work with a team of folks that are behind us, in this facility, Dakota Medical Foundation's facility, which is now this room is now our video production room. And so we're kind of excited, to do this today as well, but it's part of that adaptation with COVID. So plowing through and making sure that these communities are feeling connected and connected to the causes like yours, it has been a great adaptation for all of us.
That leads me to the question about philanthropy and what you may share maybe personally about your passion for philanthropy and what you would want others to know about it and its importance in our communities.
Well, being with the foundation for many years, I get to witness and be a part of some of the most extraordinarily generous acts of kindness. A lot of people under the radar that no one even knows about that are daily making sure that the hungry are fed, not wanting recognition for providing education, scholarships, making access to health care, much more prevalent in the community, particularly for those that might not have the ability to pay for their deductible. We get to witness all of this, and I tell you that it's a very fulfilling role for us, working here within Dakota Medical and Impact Foundations to be a part of these special acts of kindness. And again, Giving Hearts Day, it brings out the best in people. And I was so excited to hear your number, for how much you've raised, because things are happening with healthcare that otherwise wouldn't happen unless we were all working together to pull off this great event that truly brings out the best in our communities to help and care for one another. And it certainly could be, we could use more of a dose of that in our national, debate. They could look to North Dakota for how we help one another. We have days of giving. This next year, it'll be Day of Volunteering as well as giving.
I'm excited about that.
It's exciting.
There are so many opportunities to get involved. And like you said, I've worked with those that seek no recognition, although we love to be able to put names on rooms and, scream from the mountains, like, this is this person and this is what they've done. But it's very humbling when people accept no gratitude as well and do some powerful things.
Yes.
We're very fortunate to be part of this platform. It has been such a growth opportunity for me, our teams, our board, and our community. When I started even 5 years ago, as I mentioned, in Jamestown, we only had a few nonprofits participating. It's tripled. We've got close to 20, I think, now in the Jamestown region that are going to be a part of Giving Hearts Day this year. So we're very grateful. It's energizing. It feels good to be a part of their missions as well. And so as we wrap this interview today, I do want to share our acknowledgement, and it is our tree of gratitude, which I have on the table here, and it has a special meaning. We all have blessings and gifts every day. And I think it's so important to take the time to celebrate the people and the platforms that make blessings happen, and to share that gratitude and that thanks with others. Because just like a tree, that gratitude, those roots ground us and do great things for us and the future. So thank you for impacting my life, our lives at Jamestown Regional Medical Center and our community. You have truly made a difference for us and those that we serve. So thank you and congratulations on this and the success of not just these foundations, but as you said, our nonprofits, statewide and region-wide. Thank you, Pat.
Well, thank you. We're touched by the honor. We accept it with that exception that I made at the beginning to give everyone credit that's a part of all the good charitable works that we get to be a part of. And a special thanks to the people of the Jamestown region, for giving so generously and deciding in your community you're going to have a first-rate medical center. And that's what you have, and that's the benefit of bringing everyone together to do good for others. And I'm so proud you have 20 groups now in Giving Hearts Day in Jamestown. That shows what kind of a community that is. So hats off to the community of Jamestown, your leadership, the leadership of the center, the board, all the staff of your center. We're proud of them as well. They're not on camera with us, but we send our gratitude and our greatest wishes, well wishes for a wonderful future for healthcare in your region.
Thank you.
Thank you.
Thank you very much.